best teeth out of all of us. What is the
Really?
story? Seriously, your whites are much whiter than mine. The line is real straight. I mean, I'm not a dentist.
Hey, let's take you to my dentist to find out.
Who's your dentist?
We'll find out.
Oh, is this a surprise?
Yes.
Okay.
So let's take you and talk about what is important about your teeth.
I'm so excited to be here with Roshini and Preeti talking about kids' dental care. Now tell me, what is the first age that a baby or a child should walk into this clinic?
Ideally, we want to see kids 6 months after their tooth erupts into their mouth. So anywhere between the ages of 10 months and 1 year is a good age, so that the dentist can educate caregivers and parents about prevention.
Okay, now at that age, are they really scared to come here? They're like babies and little kids, and why are they taking me there? Why are they making me open my mouth? Are they really nervous coming here as kids?
No, actually they're excited. They come in, they get to sit, read books. We have a playroom. They get to sit and read books with their parents, and then they are taken into the room where they get to pick their own movies, and they don't even know when the treatment is over. And then they're rewarded with stickers and toys, and they're actually excited, and they ask their parents when are they going to see the dentist next.
Oh, because they're dealing with nice people, like, who are pampering them. So now tell me how important it is to have kids, the baby tooth taken care of. I mean, how important are baby tooth?
So baby teeth are very important because the adult teeth only come in between the ages of 6 and 12, and till then we are using our baby teeth. So it's very important for growth of jaw and self-esteem and speech.
Okay, now tell me, does it determine how we take care of a baby teeth? Does that reflect how the teeth will be when they grow up, like whether they're going to need a brace or they're going to need something else, or the cavities that happen when they're little kids? Does that reflect later on in life?
So two things. At this day and age, parents are very conscious of baby teeth and how the adult teeth are going to be. So they ask us about crowding and how the jaw growth is, and we can kind of predict if the child will have crowding and would need braces in future, or they're fine. Cavities, yes, we want to prevent any future infections and any discomfort to the children. So that's why the earlier they're taken care of, then they don't go through the whole traumatic experience if need be.
Okay, now the most important question, what are the do's and don'ts when it comes to kids and teeth? I know they love candies, they love all the sweet things and the cravings, and they don't probably brush always while going to bed. What are some of the do's and don'ts that you absolutely need to follow?
So we want the kids to develop healthy habits right from the beginning. So we encourage parents not to share their food, like their spoon, while they're eating with the kids, because these germs can easily get transferred from one mouth to the other, and caries is an infectious disease. So, and then foods, of course, like high sugar foods to avoid. There are a lot of foods which have hidden sugars like raisins and juices, which stick onto the teeth and cause caries.
Okay, what are some of the things that they can do as a baby or a kid?
The simplest thing they can do is rinse their mouth frequently. Here everybody's on the go, and the kids, they stay in the school whole day. Then they haven't brushed since whole morning to the night time. So the plaque, it builds up every 12 hours. They need to be rinsing in between the meals, definitely brushing before going to bed, and just having flossing, healthy habits, which we are all aware of. We just need to put it in action, and parents need to be role models for that.
I know. Now my favorite topic is, our community and how often do people bring their kids. And as mom, I don't think I followed religiously every step along the way to bring my child to a dentist. What would be your advice to parents like us?
Your kids every 6 months, bring them with you and make it like, everybody comes together. The kids know that the parents are there, so they're less nervous. And then we have a lot of entertainment for them over here, and basically we want to distract them.
Right now,
we want to change the attitude of getting into preventative versus the mode when something is hurting and then they're coming. So we want to change that, turn over that concept. If they're coming every 6 months, we can do preventative stuff like sealants, which is simple stuff, and the big stuff won't happen. Then big cavities or bigger problems won't happen if we're seeing them on regular basis.